Through the Kenya Institute of Primate Research now seeks to improve health outcomes, that is when it comes to matter snake bites. That is, this follows the launch of the launch of the African Snakebite Alliance, with a key focus to enhancing scientific research to boost the local manufacture of anti-venom. Every year, over 20,000 Kenyans are bitten by poisonous snakes, of which 4,000 lose their lives during the same period, while 7,000 are left with permanent disability. These rising statistics of snake bites come at a time when the country is grappling with the scarcity of snake venom, which brings to light the urgent need for Kenya to invest in the local manufacture of antivenoms, which is normally imported from the countries of Europe and India. The Kenyan government is forced to spend close to 1 billion Kenya shillings on the importation of antivenom. On the other hand, the Kenya Wildlife Service spends close to 5 billion Kenya shillings annually compensating victims of snake bites. Areas affected by snake bites are Kilifi, Kitui, Isiolo, Baringo, Machakos, Marsabit, Taita Taveta and Garissa.
The Kenya government has committed substantial funding towards the local production of safe, effective and affordable antivenoms for Kenya and East Africa region.
What we are trying to do is to address this issue of snakebite by coming up with antivenoms, or the antidote, which is a product that you give to somebody who is bitten by a snake to neutralize that poison. And one of the challenges that we've had in this country and Africa as a whole is that we rely on imported antivenom or the antidote for the snake bite, mostly from Europe and India. But unfortunately, most of those antidotes or antivenoms have very low efficacy rates, or they are not very effective. You are looking at poor efficacy rates of as low as 50%. And because of that, then you end up using a lot of materials to manage that antivenom, or rather the snake bite. So we can reduce this, or we can have an impact on this by coming up with better antivenoms that are made locally based on the venom, which is the starting material for antivenom from our region. And so today we were bringing together several countries, over 15 countries that have this problem in their regions, so that we can come up with an antivenom that can work for all the snake species. And really that is the agenda.
Elsewhere, residents of Maragua Sub-County